Multiple choice question number 1.
A 72-year-old woman complains of severe pain and tingling around her left eye for the past 2 days. On examination, vesicular lesions are noted on the left forehead and upper eyelid, respecting the midline. She also reports mild swelling of the eyelid. What is the most likely diagnosis? A. Herpes Zoster ophthalmicus. B. Conjunctivitis. C. Cellulitis. D. Eczema. E. Impetigo.
Correct answer is A. Herpes zoster ophthalmicus with a unilateral dermatomal vesicular rash involving the ophthalmic branch of the trigeminal nerve, preceded by pain and tingling. Conjunctivitis causes redness and discharge without vesicles or dermatomal pattern. Cellulitis shows diffuse erythema and swelling, not vesicular rash. Eczema is chronic, scaly, and itchy rather than acutely painful. Impetigo has honey-colored crusts, usually in children without dermatomal distribution. Early antiviral therapy is crucial to prevent ocular complications.
Multiple choice question number 2.
A 65-year-old man presents with a painful rash on the right side of his abdomen. He notes that the area was tingling for a few days before the appearance of vesicles. On examination, grouped vesicles on an erythritous base are seen following the T8 dermatome. He has no systemic symptoms. Which condition is most likely? A. Chickenpox. B. Dermatitis herpetiformis. C. Scabies. D. Cellulitis. E. Herpes zoster.
Correct answer is E. Herpes zoster in older adults often presents as unilateral dermatomal vesicular rash preceded by neuralgic pain or tingling. Dermatitis herpetiformis presents with itchy papules and vesicles, usually on extensor surfaces, not dermatomal. Scabies causes intense itching with burrows in web spaces, not vesicles in a single dermatome. Cellulitis is diffuse erythema and tenderness without vesicles. Chickenpox usually occurs in children with generalized vesicular rash, not limited to a single dermatome.
Multiple choice question number 3.
A 62-year-old man with a history of hypertension presents with sharp, stabbing pain over the left side of his chest for 2 days, followed by the appearance of grouped vesicles on an erythematous base that align along the ribs. The lesions do not cross the midline. He reports mild fatigue but no respiratory symptoms. Which of the following is the most likely diagnosis? A. Herpes zoster. B. Herpes simplex virus infection. C. Cellulitis. D. Scabies. Or E. Allergic contact dermatitis.
Correct answer is A. Herpes zoster is the most likely diagnosis because the patient presents with unilateral dermatomal vesicular eruptions preceded by neuropathic pain, which is characteristic of shingles, particularly in older adults or individuals with weakened immune responses. Herpes simplex typically affects mucocutaneous areas and recurs in the same region, but does not follow a strict dermatomal pattern, while cellulitis presents with diffuse erythema, warmth, tenderness, and systemic features, rather than grouped vesicles. Scabies causes intense nighttime itching with burrows and finger webs rather than dermatomal vesicles, and allergic contact dermatitis produces pruritic, poorly demarcated eczematous lesions that do not follow a dermatomal distribution and lack the prodromal neuralgic pain.
Multiple choice question number 4.
An 80-year-old woman presents with severe pain along the left side of her chest, followed by the sudden appearance of vesicular rash in a band-like pattern. She reports the pain started 3 days before the rash. What is the most likely diagnosis? A. Shingles-like drug reaction. B. Angina pectoris. C. Herpes zoster. D. Psoriasis. E. Erythema multiforme.
Correct answer is C. Herpes zoster typically begins with prodromal pain, tingling, or burning in a dermatomal distribution, followed by vesicular rash along the affected dermatome. Angina pectoris causes chest pain without rash. Drug-induced shingles-like reactions are rare and often widespread. Psoriasis produces chronic scaly plaques rather than vesicles with acute pain. Erythema multiforme has target lesions, usually on extremities, and is not dermatomal or preceded by neuralgic pain.
Multiple choice question number 5.
A 68-year-old man presents with a painful, burning rash on the right side of his chest for the past 3 days. He describes tingling and numbness in the same area before the rash appeared. On examination, grouped vesicles on an erythematous base are seen along the single dermatome on the right thoracic region. He reports no similar past episodes. What is the most likely diagnosis? A. Dermatomal psoriasis. B. Contact dermatitis. C. Impetigo. D. Herpes zoster. E. Bullous pemphigoid.
Correct answer is D. Herpes zoster is characterized by prodromal pain, burning, or tingling in a dermatomal distribution followed by grouped vesicles on an erythematous base, typically unilateral, and common in older adults due to reactivation of latent varicella zoster virus. Contact dermatitis can mimic a rash, but usually presents with itching rather than pain, often patchy or widespread, and without a dermatomal pattern. Impetigo is a superficial bacterial infection with honey-colored crusts, mostly in children, and lacks dermatomal distribution or preceding neuralgic pain. Dermatomal psoriasis is chronic, scaly, and non-vesicular, not associated with acute pain or unilateral dermatomal involvement. Bullous pemphigoid presents with large, tense blisters symmetrically on flexural surfaces in older adults without prodromal neuralgia or dermatomal limitation, distinguishing it from herpes zoster.